Hi, I am Dr. Shivam Shinghla. I am a cancer specialist at Raheja Hospital, Mumbai. We all know that the incidence of cancer is increasing multifold in our daily lives. We can see today any one of our relatives or someone who is known to us in the society or our friends are suffering from cancer. We now understand today that cancer is a lifestyle disease. The major cause of cancer in general population is a poor diet intake. People are taking more calories which they can consume. They are not exercising and they are not sleeping well. Apart from this, the environmental pollution contributes to the higher incidence of cancer. In India, what we are seeing today is that the cancer is affecting more and more younger people. When I talk about cancer, typically in India, we get about 15 lakh cancer patients in the cancer registry. We also know that the incidence of cancer is at least 3 times higher than what is reported. So what are the typical cancers we are getting? One, we get a lot of patients of lung cancer, typically 1.1 lakh patients of lung cancer. Lot of patients of breast cancer, 1.2 lakh patients of breast cancer. Cervical cancer is also rampant in India, and then the majority of cancers are oral tobacco intake related cancers. Now, we as a community can fight against this menace of cancer if we take care of 3-4 basic general principles in our lives. We can actually eradicate cancer risk for ourselves. World Health Organization says that 1 in 9 individuals is likely to get lifetime cancer in India. This is today. In 2026, this number may go up to 1 in 6 or 1 in 7 individuals. And this is very scary. That means that if you have 10 friends, 1 or 2 of them are likely to suffer from cancer. Now, what should we do as individuals to fight this cancer? 1, we will pledge that we will have a healthy lifestyle. We will eat appropriate amount of calories, we will work out. We'll do regular exercises, we'll sleep well on time, and we will try to protect ourselves by taking adequate vaccines against the cancer. When I talk about vaccines, there are 2 cancers which can be preventable by vaccines. One of them is a cervical cancer, which is very common in women. Women can take a vaccine, we call it as Cervarix. This vaccine can be taken before the age of 18 or 19 years. 2 shots, and this can eradicate the risk of getting cervical cancer. The second is a vaccine against liver cancer. We have vaccine against hepatitis B. This is very easily available in the market, and then we can prevent and reduce our incidence of this infection, leading to prevention from this type of cancer. What else we can do? We can screen ourselves for cancer. So typically, women should start doing mammography at the age of 40 years, and this can be once in 2 years or once in 3 years. Men and women both should look at a colonoscopy after the age of 45 years to screen themselves for the incidence of colon cancer. Additionally, men should look at doing a prostate-specific antigen test, we call it as a PSA test, after the age of 60 years. Also, women who are in the childbearing age group from the age of 27 years to 40 years should look at doing a pap smear to reduce the risk of developing cervical cancer. I recommend that cancer is a lifestyle disease. I urge all of you to join our hands together in fighting the menace against the cancer. What else we can do? We can give strength to the cancer survivors. We can give them courage to fight the cancer better. I also urge all of you to do insurance against lifestyle, future diseases that are likely to happen. So please get yourself insured, do regular screening, and reach out to us if you are worried about any symptom that may be closely related to cancer. Thank you.